another couple, their mom, a friend, and we stayed there. And it was in Provence, in this like medieval walled village that had a winery at the base of the mountain, and a like wine and truffle restaurant at the top of the mountain. It was pretty amazing. And by a mountain, I mean a hill. But we were able to go every day. We could go to like different towns in Provence, and every one of them was different. And then on the last night, we decided to go just wine touring, and Gigondas happens to be right next to it. So from what I had read, it seemed to be, the best place, and it had the most concentrated amount of vineyard. So we went there, and the wines were, I mean, I love provincial wines anyway, because I like really, really big, bold wines. And just every single wine we tasted was like, it would stick to your teeth and like turn your lips purple, and had a lot of tannins, which is what I love. So I just kind of fell in love with it. Just as far as geography, so Provence is so Gigondas is right by Châteauneuf-du-Pape. So if you're familiar with Châteauneuf-du-Pape and that denseness, those are the wines that you get in Gigondas, but maybe not always at that same price point.
Nice. That's
Yeah.
awesome. That's great to know. I'm gonna have to look into that one. All right, I'm drinking my Costco special today. I'm drinking this Kuhn 2016 cab. So nothing special, but it's a good daily wine for a wind down, and hopefully I'm trying not to finish the bottle. I have a few more conference calls later on, but I'll probably have a few. All right, give me a quick intro for the folks who are watching, your background, who you're with, and let's talk about your world right now and in the COVID world.
Sure. So, Ana E. Santiago, I am the Chief Information Security Officer at Christiana Care. Christiana Care is the largest healthcare system in the state of Delaware. And although Delaware is small, Christiana Care is actually pretty large. I think in terms of admissions, we may rank 24th in the country. So we've got a couple of large integrated health hospitals. We've got freestanding EDs, the urgent care centers, physician practices, primary to specialty. We own an ACO. We're a member of Delaware Health Information Network. We actually have a population health service that we utilize for ourselves and for our patients and our caregivers, but we also provide it to other organizations to help manage their populations.
Nice. So obviously, security top three initiatives. For the folks watching, if you want to ask questions, just type in the comments. I'll be more than happy to read through those and ask away. But security is top of mind for everyone. Top three initiative on the board. Now, with this massive folks working from home, organizations have scaled all of a sudden. And now devices are home. People are using telemedicine. The rules are getting relaxed. I mean, how do you feel about that? Are you anxious? Do you feel okay? How do you sleep at night now?
I feel good. I actually feel great, and I have to sometimes I have to temper my excitement, because we are at a time that's really stressful for everyone across the world. But in healthcare, there's a positive and a silver lining to all of this, and I think we're in a really exciting time in terms of being part of healthcare transformation in the adoption of just health IT beyond EHRs and into telehealth and into remote work and virtual visits and doing things that we've been talking about for years, and that now we've all of a sudden, sped up all that work that we thought was going to be so hard and accomplished something within a month that probably would have taken upwards of a decade to accomplish. So it's a great time to be in healthcare. It's a great time to be in healthcare IT, and in terms of being a cybersecurity professional, we don't sleep anyway, which is why we need the wine. But I I think working for an organization that prioritizes cybersecurity helps me to be able to feel good about the work that I do day in and day out, feel good that we're managing the risk to acceptable levels, feel good that I have a seat at the table, and that as we're endeavoring in all of these initiatives, I am consulted and we have a hand in architecting it from the ground up. So I feel comfortable that the initiatives that we're rolling out aren't adding undue risk to our organization. And yes, people working from home creates a unique set of risks, but we're managing it the same way that we manage everything else in an organization of our size. We just scale up our monitoring, we scale up our policies, we scale up our controls to make sure that as we're growing and expanding, we're doing it at the same scale from a cyber perspective as we are from a technology perspective.
Yeah, no, that's great. Remember Brian Pruitt from NetApp? He was at our Vegas event. He just said cheers to you virtually. So I'll give him a cheers back as well. So let's talk about the telemedicine, right? The recent ruling where they're going to relax the security or the potential HIPAA fines. We don't know what that means, but it's almost read and interpreted by a lot of legal firms and organizations as if Facebook Messenger, FaceTime, and your iMessage are sources that could be used for telemedicine. How do you feel about that? Is it okay?
So I feel that in the face of this pandemic, it's great that the regulators are actually prioritizing lives as opposed to what some might even consider archaic regulations. I was asked earlier today by somebody else if how I felt about putting aside regulations and protocols in order to to assist our caregivers in delivering care. I'm not okay with setting aside protocols or regulations or compliance in order to do something. I am a firm believer that if things are in place, they're in place for a reason. We need to figure out how to enable caregivers without adding undue risk, either from a regulatory perspective or from a cyber perspective. But I do think for an organization of our size, we already have tools and resources in place that we can leverage. And so our reaction to some of these new rules has been, and I'm speaking cyber, because
Sure.
obviously there are a lot of things around licensure and crossing state borders and other things that are beyond the scope of my purview. But in terms of cyber and using these apps, we have technologies that we can enable. So our direction was time out. Yes, we too are seeing all of these reports, but no, that doesn't mean that you can just pick up your phone and start using it. We have tools and workflows that are clinically driven and designed that we want you to use. And so we're steering everybody that way. But I'm speaking for an organization of our size. There are a
Right.
lot of smaller, mid to small, even single practitioners that don't have the luxury of employing enterprise license Zoom capabilities and Microsoft Teams and some of these other things. So for them, this is really important and necessary. And so, if I had a small practitioner just call me and ask us for some advice, I would tell them, go ahead and use uh, the iPhone,
Yeah.
FaceTime, go ahead and use the Google Hangouts. Just remember that there are privacy implications here that you're going to have to let your patients be made aware of so that they're not just going into this ignorant. Be a partner with your patients, but patient care is super important always, if not right now. So if these technologies are the only way that they can care for the patients, then I encourage them to use them.
Yeah, that's a great point as far as just explaining to the patient that this may not be the best method, but during a time of crisis, we're going to use it because that is all we have. So I think that's a great approach. I haven't heard too many organizations with the flexibility to adopt that. So I'm glad that a lot of the CISOs, like yourself, are receptive because there's a perception that CISOs are not as lenient. They don't bend. They're very rigid. So hearing that from someone who's as renowned as yourself makes it really comforting in the industry, especially. So as we move towards the next phase, lots of bad actors now. I mean, what should organizations be prepared for now as all the bad actors are sort of acting up? Everyone's vulnerable. Top three tips for organizations in healthcare right now that you recommend.
So I want to say, I want to be very clear. The threat actors are really ramping up. This is the threat landscape, and the level of activity that we are seeing is unprecedented. And I have been at this for 15 years at this level. I've never seen anything like this. The threat intelligence that we're receiving is almost on an hourly basis, and the creativity of some of the things that I am seeing are astounding. So in terms of what I would tell healthcare organizations is, you have to be vigilant. If you have the tools in place, such as email security tools, cloud access security brokers, security incident and event management tools, make sure that you are monitoring them, that you set up the alerts, that you are looking at your logs for unauthorized activity, that you are ramping up the scores on email security appliance to really allow only what is at best legitimate, and that you're monitoring what's getting through. For those smaller, well, for every organization, but especially for those smaller ones that maybe don't have the resources or don't have security teams,
Yeah.
your most important tool is education and awareness. If you have a small team, a small staff of caregivers, you have a better shot actually at getting to them than somebody in an organization of our size, where we have to get to tens of thousands of people. But let them, remind them about phishing threats. Remind them to be really careful about which websites they visit, and if they want information to go straight to the CDC or straight to the World Health Organization, don't click on links from people pretending to be CDC or the Red Cross looking for donations. Yeah. These are very real things. Don't pick up the phone and believe that somebody needs your financial information in order for you to get that check. They're not calling you for that kind of stuff. So education awareness for any organization is really important, but for the smaller ones that don't have the tools, that's the most important and most powerful one.
Yeah, no, definitely. Education is something that's not replaceable. I mean, I even had the incoming CEO for an organization clicked on a phishing campaign for his bank account, gave away his bank account. So, I mean, this happens to everyone, senior leaders who just have not taken it seriously. Obviously, right after that incident, budget was approved. Do whatever you can to ramp up and with training, education, and tool sets, because once it affects someone's personally, it starts to hit them. So, last question: post COVID. I mean, we'll get through this stage. What should be top of mind? Continue what they're doing in terms of posturing. Is there anything that comes top of mind post COVID in your mindset?
I think post. So I think some of this is the new norm. And I'm speaking specifically about healthcare technology, telehealth,
Yep.
remote work. We've proven that it works. A lot of the skepticism that was formerly out there has been proven to not be valid. And so this is how we're going to work, whether it's, we scale down a little bit, but people are going to demand it, or whether a lot of us just remain. I mean, I can't imagine our virtual practices and our virtual center excellent all of a sudden, closing shop and going back to business as usual. So I think this is it. And so don't assume that things are going to go back to the way that they used to be, because I just don't think that they are. So don't design what you're doing today with stopgap measures because you think they're going to go away. Build the security and architect it from the ground up so it's sustainable, because we're not tearing this stuff down anytime soon. I think it's here to stay. My boss says, and I always mess this up because I can never get it right, but if it's digital, people are going to want to consume it digitally, and if it can be delivered at home, people are going to want to consume it at home. So we've now proven that this is something that we can do. So I just don't see a way to go back, and I don't see why we would want to.
Yeah, no, exactly. I think the two themes that are going to stick around, I just tweeted about this earlier this morning, are telemedicine is here to stay. It will be part of the norm for care delivery, and work from home is here to stay. As much as we fought it throughout the hospital and health systems, now that we're going through it, we will see the benefit of it. It will be the norm. Employees will enjoy working from home, and we could save some of those high dollar real estate in the hospital to really provide care rather than have administrative staff. So those are the two areas where I definitely agree with you, where that is going to be the norm. Well, there you have it. One of the top CISOs in the country, Anahi. Cheers to you as always. Thanks for joining us and thanks for the chat. We'll talk soon.
You take care.
Thanks.
Bye bye.
All right. So